Cytomegalovirus Immune Glob Solution is used to prevent a certain serious viral infection, cytomegalovirus-CMV, in persons having an organ transplant, kidney, heart, liver, lung, pancreas. During the transplant process, the body's defense system, immune system, is weakened to prevent the body from attacking, rejecting, the new organ. A weakened immune system increases the risk of a serious, possibly fatal infection with CMV. This medication is made from healthy human blood that has a high level of certain defensive substances, antibodies, that help fight CMV. This medication is often used with the antiviral medication ganciclovir. It is important to follow the dosage and timing recommended by your healthcare provider for the best results. This medication is administered slowly through a vein, as directed by your doctor, usually every 2 to 4 weeks, with the first dose given within 3 days of the transplant. The dosage and frequency depend on your medical condition, weight, and response to treatment. Your healthcare professional will start the medication slowly while monitoring you closely. If you have few or no side effects, the medication will be given faster. Tell your healthcare professional right away if you experience any side effects such as flushing, chills, muscle cramps, back/joint pain, fever, nausea, vomiting, or shortness of breath. The infusion may need to be stopped or given more slowly. If you are giving this medication to yourself at home, learn all preparation and usage instructions from your healthcare professional. Before using, check this product visually for particles or discoloration. If either is present, do not use the liquid. Learn how to store and discard medical supplies safely. Use this medication regularly in order to get the most benefit from it. Keep all your medical/lab appointments. Some common side effects of cytomegalovirus immune glob solution include flushing, chills, muscle cramps, back/joint pain, fever, and nausea/vomiting. You may also experience pain, redness, and swelling at the injection site. If these effects continue or become bothersome, it's important to tell your doctor. It's important to remember that this medication has been prescribed to you because the benefit outweighs the risk of side effects. While many people using this medication do not experience serious side effects, it's important to tell your doctor right away if you have any serious side effects such as easy bleeding/bruising, fast/irregular heartbeat, unusual tiredness, or signs of kidney problems. In rare cases, treatment with this medication may cause inflammation of the brain or lung problems. If you experience severe headache, stiff neck, drowsiness, high fever, sensitivity to light, eye pain, severe nausea/vomiting, or lung problems, seek medical help immediately. A serious allergic reaction to this drug is rare, but if you notice symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing, seek medical help right away. This is not a complete list of possible side effects, so it's important to contact your doctor or pharmacist if you notice any other effects not listed above. If you experience any side effects, it's important to consult your doctor for medical advice. Serious blood clots are a rare but possible side effect of cytomegalovirus immune glob solution. Older adults, severely dehydrated individuals, those with certain medical conditions, and immobile individuals are at an increased risk for blood clots. If you have any of these conditions, it's important to discuss the risks and benefits of this medication with your doctor or pharmacist before using it. To reduce the risk of blood clots, the medication can be infused more slowly or in a less concentrated form if available. Staying well hydrated before receiving the medication may also help lower the risk. If you experience shortness of breath, chest or jaw pain, sudden dizziness, or other concerning symptoms, seek medical help immediately. Before using cytomegalovirus immune glob solution, it's important to let your doctor know if you are allergic to it or other immunoglobulin products. This medication may contain inactive ingredients that can cause allergic reactions, so it's essential to discuss any allergies with your pharmacist. You should also inform your doctor of your medical history, especially if you have certain immune system problems, diabetes, high blood pressure, high blood fats, migraines, current blood infection, kidney disease, or severe dehydration. If you have had recent or planned immunizations/vaccinations, it's crucial to tell your doctor. This medication may prevent a good response to certain live viral vaccines, so your doctor may have you tested for a response or have you vaccinated again later. They will also instruct you about the best time to receive these vaccines for a good response. Since this medication is made from human blood, there is an extremely small chance of getting infections from it, even though the blood is carefully tested and the medication goes through a special manufacturing process. It's important to consult your doctor or pharmacist for more information. Before having surgery, it's essential to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, this medication should only be used when clearly needed, and the risks and benefits should be discussed with your doctor. It is also unknown if this drug passes into breast milk, so it's important to consult your doctor before breastfeeding. It's important to be aware that cytomegalovirus Immune Glob Solution may interact with other medications you're taking, which could affect how they work or increase the risk of serious side effects. Always keep a list of all the products you use, including prescription, non-prescription drugs, and herbal products, and share it with your doctor and pharmacist. Never start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with cytomegalovirus Immune Glob Solution include drugs that may harm the kidney, such as aminoglycosides like gentamicin, and water pills like furosemide. Be sure to discuss any concerns with your healthcare provider. If you or someone else has taken too much cytomegalovirus Immune Glob Solution and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical attention. In the U.S., you can call your local poison control center at 1-800-222-1222, and in Canada, you can reach out to a provincial poison control center. It's essential to act quickly in these situations to ensure prompt and appropriate medical care. Make sure to schedule regular lab and medical tests, such as kidney function and urine volume, while using cytomegalovirus Immune Glob Solution. It's important to keep all medical and lab appointments and consult your doctor for more details. This medication is used to prevent or treat cytomegalovirus-CMV infection in people who have received an organ transplant. It is also used to prevent CMV infection in high-risk infants. The dosage and timing of this medication will be determined by your doctor based on your specific condition and medical history. Be sure to follow their instructions carefully for the best results. Make sure to take each dose of cytomegalovirus Immune Glob Solution as directed by your doctor. If you happen to miss a dose, contact your doctor or pharmacist for a new dosing schedule. Do not take a double dose to make up for the missed one. When using cytomegalovirus Immune Glob Solution, it's important to store it in the refrigerator and use open vials within 6 hours. Any unused portion should be discarded, and it's crucial to keep all medications away from children and pets. Remember not to flush medications down the toilet or pour them into a drain unless instructed to do so. It's important to properly discard this product and it is expired or no longer needed. If you have any concerns about disposal, consult your pharmacist or local waste disposal company. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.